Oh, it's taken a big toll. I mean, I've lost relatives. I've had relatives that had it that were close to passing, but they survived. And thank goodness for that. But one of my cousin, she was an RN nurse at the beginning of COVID. And back then, I think it was in 2019 when it all hit, she was admitting people that were coming in sick in ER because she was an ER nurse. Unfortunately, she got it and she got so deathly sick that she actually went into a coma and then she passed. That was a big hit to our family because, it was like that close to us that it affected our family. My mom, she was elderly too, and it affected her like 3 times. But fortunately, she was okay. She did get sick with, the basic symptoms and stuff, but she was in a care facility at the time when she got them both times. The first time she got it for my sister because she was caregiving for her. And my sister, she works in a public health situation, but at that time she was working at home. Somehow my sister got it by going out and running errands and getting things for my mom, and she was at home because she was really disabled. My sister was hit hard and she was trying to caregive for my mom. That's where my mom got exposed. So, it has affected, and then also just hearing many people on the reservation passing from it. People weren't really aware of what it was. It was a big question mark. What is this? It's killing a lot of our loved ones, friends, family, neighbors, and, it was really a big question mark, how this just devastated everybody, not just here in the Southwest, but also out in Indian country as well. I think it's important to protect yourself, and not only just yourself, but people around you that are close, that could be vulnerable, like your grandma, your mom and dad, other siblings, people you work with, just everybody you come in contact. It's, they can get it too. It's a contagious disease is what it is. I would tell them I've had it and it's never affected me in an adverse way. It's just like getting any shot. It's just one little poke and you're done, but you'll have a sore arm, yeah, but that's pretty common in most vaccinations anyway. I would say there's nothing to be afraid of. You're just not only saving your life and reducing the symptoms and the illness and hospitalizations by getting a vaccine. If it was somebody I didn't know, I would even provide a ride, just take him to the doctor, and see a county nurse or public nurse, nearby that does the vaccinations. There's always somebody around that has a vehicle or transportation that they can ask, and I'm sure they would. It's for your own safety. It's for your own health. You heard in the news, whether it be radio, TV, or however, social media, how they, wrote it out there that, it's something you don't want to get. If we're going to meet like this, whether it be in person or wherever, if we travel or if we ride together, I hate to say this, but I can't be around you unless you're vaccinated. Or it's hard to say this because, I'm protecting myself and I don't want to get sick.